Hello everyone, welcome to my presentation. My name is Jasmine Nehema, and today I'd like to talk about my research work, which was on synthesis, characterization and anti-cancer application of platinum to thiochemic complexes. My co-authors are Professor Lydia Njenga and Dr. Ruth Odhiambo, both from the Department of Chemistry, University of Nairobi, Kenya. I also have Professor Martin Onani from the Department of Chemistry, University of Western Cape, South Africa, which is where I did most of my work. I also have Professor Marvin Meyer and Dr. Lawrence Swartz from the Department of Science and Technology at the University of Western Cape, South Africa, who also helped with a part of this project. Welcome. So I was working with coordination metal complexes, and just a little background on that is that they are formed when a ligand donates a pair of electrons to a transition element with a partially filled d orbital to form a dative bond. Some of their unique characteristics include varying oxidation states, distinct colors, and magnetism. That is why they find various applications such as catalysts and a lot of drugs in metallurgy and as chile therapy, among many others. Have you ever wondered why your blood is red? Yeah, you probably have, and already know that it's because of hemoglobin. And the most amazing thing is that hemoglobin is a coordination compound. Yeah, nature is pretty amazing. And this hemoglobin is a coordination complex of the iron and with 4 porphyrin ligands. Other biocoordination compounds include chlorophyll and vitamin B12. The metal I chose for my research work was platinum, and this is because platinum is a good choice for biological application. Being that I intended to use the compounds that I will synthesize to test for their usefulness as anti-cancer drugs, then I needed to use a metal that is relatively inert, which means that it will not allow for unnecessary ligand exchange reactions. And just a little bit background on platinum is that there are 6 naturally occurring platinum isotopes and about 34 synthetic ones. And on its own, platinum is very useful. It's used as a catalyst in fertilizer production and also for the synthesis of some drug compounds. One of the first considerations I made before starting my work was to understand the current cancer chemotherapy drugs that are in use, what is working, what is not working, and why. And one of the things that I found out from very early on in my research is that cisplatin was the first ever metal-based anti-cancer drug to have been successfully synthesized and used on the human body. And because of its early on success, then it became the benchmark for cancer chemotherapy drugs for a long time. And however much it may be effective on some cancers, then cisplatin also poses some challenges, and one of them is that it may lead to resistance. The mechanism of action of the cisplatin is that it has 2 amino ligands and 2 chloroligands. When it is introduced into the body, then the chloroligands are supposed to be replaced by water molecules in the body, and this then makes it possible for the drug to enter the cells and cause and prevent the DNA replication of the cancer cells. However, sometimes the amino ligands may be replaced as well by sulfur which is abundant in the body. And when this happens, then the drug's intended form is completely altered, and it's unable to prevent the replication of the DNA of the cancer cells. In this case, it may cause resistance. That is why over time, in a bid to improve the efficacy of the chemotherapy drugs, then other cisplatin analogs have been synthesized, and the bias has been towards bulkier ligands. My findings informed the choice of the ligands that I was going to use, and that is why I went for the semicarbazole ligands, which are bulky. Now, the semicarbazole ligands and their complexes have been found to be good anti-cancer therapies. The ligands are usually synthesized by condensation reactions between suitable aldehydes or ketones and amines, and the complexes can be synthesized using the ligands and their metal precursors of choice. The complexes are usually chelates, therefore they can easily interfere with the DNA synthesis of the cancer cells and prevent its replication. When in solution form, the semicarbazole ligands exist in an equilibrium mixture of the thiol and the thione. The thione acts as a neutral bidentate ligand, as illustrated in the very first structure. The thiol forms complexes by proton loss, as illustrated in the very second structure. Sometimes the thiol can be tridentate or tetradentate, which depending on whether there are additional binding sites adjacent to the S-cell donor system, and the tridentate form is illustrated in the third structure. On to my methodology. All chemicals were purchased from Sigma Aldrich, South Africa. Synthesis was done using a Schlenk line, which was all under nitrogen, and the FTIR, VVBs, NMR, and equipment were from the University of Western Cape in South Africa, and elemental analysis was done at the Stellenbosch, USA, South Africa. For the purpose of this presentation, I have selected one of the compounds that I synthesized to explain my methodology. The first part was the ligand synthesis, and I used the amine there and the aldehyde, and this reaction was monitored using FTIR, and it lasted for 6 hours. Once the endpoint had been reached, the reaction was stopped, and the compound was filtered and recrystallized in DCM and hexane, and then taken for further characterization. The second part of my methodology was the complex synthesis. I used the ligand synthesized in the first step and potassium tetrachloroplatinate as my metal precursor. The reaction was also monitored, and once the endpoint was reached, which was after about 3 hours, then the compound was filtered and taken for further characterization. The third part of the methodology involved the anti-cancer screening of the ligands and the complexes. Commercially available cancer cell lines were selected and cultured. The cells were treated using different concentrations of the ligands and complexes in 96 cell plates for 24 hours. The plates were then subjected to MTT assay, and the responses were read using a microplate reader. The results were analyzed and compared to cisplatin. The first characterization technique used for the ligand was the proton NMR. The imine proton observed at 8.23 ppm, which is a singlet, was an indication that the deoxymicarbazole ligand of interest had been successfully synthesized, which was resulting from the reaction between the aldehyde and the amine. The structure of interest was further confirmed by considering every peak. The first peak was a triplet observed at 1.15 ppm, which was assigned to proton 1 on the ligand. The peak was a triplet in the ratio of 1:2:1 because of the methyl protons at that position that couple with each other, which therefore accounts for 3 protons. The second peak was observed at 2.8 ppm, which is a quartet in the ratio of 1:3:3:1 because of the methylene protons at position 2 that couple with each other and the neighboring methyl protons. Therefore, this peak has accounted for 2 protons. The multiplicity deduction for the first and second peak can be seconded by the fact that methyl and methylene protons have a high electron density, which results in greater shielding, and because the protons experience lower external magnetic fields, they therefore require a lower frequency to achieve resonance. This explains the upfield chemical shifts of protons at position 1 and 2. The proton peaks on the thiophene moiety, which is 3 and 4, are observed at 6.7 ppm and 7.15 ppm. These peaks account for 1 proton each. Both are doublets because they couple with each other, because they are only 3 bonds away, therefore J3. The protons on the benzene moiety are represented by 3 peaks. Protons 8 and 12 are in the same chemical and magnetic environment, and their peak is observed at 7.65 ppm. These 2 peaks represent 2 protons. This peak represents 2 protons, which is a triplet because it couples with protons 9 and 11. Protons 9 and 11 are also in the same chemical and magnetic environment, which is why they are observed as a single peak at 7.20 ppm, and it represents 2 protons. The peak is a triplet because protons 9 and 11 couple with protons 8 and 12. The third aromatic proton peak is observed at 7.0 ppm, which represents proton 10. The peak appears as a triplet because it couples with proton 9 and 11. The hydrazine protons 6 and 7 are observed at 10.5 ppm and 9.5 ppm respectively. Both peaks are observed downfield because of the strong deshielding effect of the nitrogen. Another confirmation that the peaks are indeed for the hydrazine protons is that they are both broad singlets because the protons are exchangeable and do not couple with neighboring protons. Homonuclear correlation spectroscopy data was acquired for the ligand to confirm the proton assignments made. These spectra shows protons that couple with each other, and from that data we were able to confirm that the assignments we had made using the proton NMR data 1D was accurate. The carbon-13 spectra was acquired for the ligand as well, and the imine carbon shift at 137.92 ppm indicates the formation of the semicarbazole ligand. The absence of the aldehyde carbon peak, which usually appears between 195 ppm and 205 ppm, was another indication of successful formation of the semicarbazole ligand. In addition, all the carbon-13 NMR peaks were accounted for and assigned respectively. Distortionless enhancement by polarization transfer depth data for the ligand was also acquired. This is a 2D NMR technique used to determine the presence of primary, secondary, and tertiary carbon atoms. There was only one negative resonance with a chemical shift of 23.37 ppm, which is associated with the methylene carbon. The methyl carbon and the aromatic carbons all had positive resonances, and these further confirmed the previous assignments that were made using the carbon-13 spectrum. The heteronuclear multiple bond correlation HMBC data for the ligand was also acquired. The HMBC is a 2D NMR technique that shows correlation between protons and heteroatoms separated by 2, 3, or 4 multiple bonds, and it is based on small coupling constants. The HMBC spectrum showed the carbons with low coupling constant. This data was further used to confirm the structure of the ligands and its NMR assignments. The heteronuclear multiple bond correlation HMBC data for the ligand was also acquired. The HMBC is a 2D NMR technique that shows correlation between protons and heteroatoms separated by 2, 3, or 4 multiple bonds, and it is based on small coupling constants. The HMBC spectrum showed the carbons with low coupling constant. This data was further used to confirm the structure of the ligands and its NMR assignments. The heteronuclear single quantum coherence HSQC data for the ligand was also acquired. The HSQC is a 2D NMR technique used to determine proton-carbon single bond correlations. Deductions were made from the HSQC spectrum to determine the carbon nuclei that were separated from proton nuclei by one bond. This further confirmed the assignments that were made from the 1D NMR. The ligand and complex spectra are as shown. When it comes to a ligand, the aldehyde functional group that had been previously observed as 1690 was absent in this spectrum. There was also an appearance of an imine peak at 1593 and a C-double bond S peak at 1071. These observations confirmed that the product of interest had been successfully synthesized. With regard to the complex, the FTIR data provided important information on the atoms that had been involved in the coordination of the ligand to the central metal atom. In this particular compound, the C-double bond S functional group and the imine functional group had been shifted to lower frequencies. This was an indication that the coordination happened via the imine, nitrogen, and the sulfur atom. This is because the chelation of the ligand to the metal center reduces the electron density on the pi bonds. That in turn decreases the pi bond character and thus weakens the bond. The NH functional groups were not observed in this spectrum for the complex, which shows that the complexation happened through proton loss. Another technique that was used to confirm the mode of complexation was the proton NMR of the complex. The spectrum confirmed what we had seen from the FTIR, which is that there was a shift in the imine proton and the NH proton was absent. This confirmed that indeed complexation had occurred via the imine nitrogen and the amide sulfur, and all this had happened by proton loss. UV data of the ligand in the complex is as shown. The N to pi star transition in the ligand was observed at 246 nanometers, while that of the complex was observed at 256 nanometers. The pi to pi star transition in the ligand was observed at 346 nanometers, while that of the complex was observed at 357 nanometers. These absorption bands were below 600 nanometers, suggesting large crystal field splitting, which is concurrent with square planar geometry. This suggests that the complexes were all square planar. The elemental analysis data for the ligand and the complex is as shown. The experimental data was compared to the theoretical data, and they all agreed with minor differences, or rather they were agreeable, and this confirmed that the compound of interest had been formed and was of the required, or rather of a good purity. The IC50 values of the ligand and the complex on different cancer cell lines was recorded and is as shown. Generally, the complex had better activity than the ligand. This shows that indeed complexation has the potential of improving the activity of a compound. Now, all this data was compared to cisplatin. For the CACO, which is a colon cancer cell line, the complex was slightly better than cisplatin. Also on the HC29, it did pretty well compared to the cisplatin. The cisplatin is slightly better than the complex, but not such a big margin. In conclusion, for the semicarbazole ligands and their respective platinum-2 complexes were successfully synthesized and fully characterized. These ligands were bidentate and they were SN donors. Many of the complexes had better activity than their ligands. This shows that complexation improves activity of the compounds. Some of the compounds had better activity than cisplatin. On to my acknowledgement. I would like to first thank Almighty God, my sustainer and my provider, and my supervisors, Professor Lydia Njenga, University of Nairobi, Dr. Ruth Odhiambo, University of Nairobi, Professor Martin Onani from the University of Western Cape, South Africa, for their guidance throughout his research. I'd also like to acknowledge my sponsors, ISP, under the Ken 01 project at the University of Nairobi, Kenya. I'd like to also thank the entire Department of Chemistry, University of Nairobi, both the staff and my fellow students for their support throughout this research. I would also like to thank the Department of Chemistry and the Department of Life Sciences at University of Western Cape, South Africa, for their guidance and support throughout the research. I would also like, in a very special way, to thank my colleagues, family, and friends. I have come to the end of my presentation, and I'd really like to thank all of you for listening, and do have a lovely time. Thank you.